welcome to Nurse Talk, Healing with Local Wisdom. I'm Ninda, and today we will explore a very exciting topic with our special guest. Our guest is Mrs. Swaida, a lecturer with strong background in tropical nursing. Welcome to the podcast, Mrs. Swaida.
Hello, thank you for joining this podcast. I hope this discussion is helpful for Tropics, our tropical nurse podcast followers.
Okay, so what is tropical nursing exactly?
Tropical nursing is the practice of nursing focused on prevention, care, and health education in regions with a tropical climate, warm, humid, and ideal for the spread of infectious diseases.
So, what kind of diseases are usually addressed in tropical nursing, Mrs. Swaida?
Many tropical diseases are endemic to tropical regions, although not all are. Their causes are diverse. For example, dengue fever is a viral disease common in tropical regions and transmitted by the Aedes aegypti mosquito. Meanwhile, tuberculosis or TB, although present in many regions of the world, remain high in many tropical countries and is caused by airborne bacteria. Malaria, another example, is caused by the Plasmodium parasite and transmitted through the bite of the Anopheles mosquito. In other words, vector-borne diseases like malaria and dengue fever are very common in tropical regions, especially in environments with poor sanitation and limited access to healthcare.
Wow, so tropical nurse must be ready to face environmental, social, and even cultural challenges?
Exactly, that what makes tropical nursing unique, so essential in regions like Indonesia.
Okay, let's go to the core questions. What are kind of tropical disease and why is tropical nursing important?
Tropical diseases are commonly found in hot and humid regions like Indonesia. They spread through mosquito, contaminated water, or poor living conditions. But they are not just infections. They are also about poverty and vulnerable living environment.
Wow, that's interesting. And why do nursing students specifically need to learn about tropical disease, Mrs. Swaida?
Because tropical diseases have unique epidemiological patterns, cultural perceptions are also diverse. Nurses need to understand not just the clinical part, but also how to communicate with cultural sensitivity.
Okay, let's move to my favorite part, local stories. Can you share a real example of how people perceive a tropical disease?
Sure. For example, in Java, when someone has a high fever and body ache, people say it's masuk angin or wine sickness. They treat it with skin scraping or herbal drinks, but medically it could be dengue or malaria.
Wow, that can be dangerous if they delay seeing a doctor. Any other examples?
Yes, in entity, teen children are said to have hot stomach from eating instant noodles. They get boiled papaya leaves. It could actually be worm infection. Or in Kalimantan, TB is seen as a family curse. So patients avoid treatment until a traditional ritual is done.
This shows how strong local beliefs influence treatment-seeking behavior. Nurses need to be the bridge between medicine and culture. Thank you, Mrs. Swaida, for the eye-opening discussion. In the next episode, we will talking about the most common tropical disease. See you next time and stay healthy.